Okay.
Done for. Yes, ma'am. Almost.
मैं 2 दिन 2 ज्योतिर्लिंग को
time.
जाके आई तो इतने ये हो गए मेरे पूरे भगवान के दोरे हाथ में हैं। चालू करते हैं, बात करते हैं। गुड इवनिंग एवरीवन। यस पीयूष।
Ma'am, it's live now. Yes, ma'am. Let me share my screen. Yes, ma'am.
Your voice has gone very low.
Okay, ma'am. Ma'am, it will be now.
Yeah,
fine.
it is back. Yeah.
It is fine, right?
Yeah.
Okay,
Fantastic, Piyush.
Okay, done. Is my screen visible?
Yes.
Okay. Good evening, delegates. A very warm welcome to this, again, one more CME Series 11 on MTP Laws and Amendment 2022, July 10th, by Dr. Sunita Tendulkar. I strongly welcome you all, and as per the tradition goes, let's start the session with a lamp lighting ceremony.
There is a music to this lamp lighting. That's okay.
Allow me to introduce one of the finest and one of the prestigious personality of India today. We have Dr. Sunita Tendulkar with us. She is well known an IVF consultant, endoscopist, and obstetrician who was past president of Pune OBGYN Society and also president of Indian Association of Gynae Endoscopy. A very, very, very warm welcome, ma'am. And we are looking forward to hear a lot from you and gather a lot of knowledge from you. Handing over the session to you, please, ma'am.
Thank you, Piyush. Thank you. Friends, I'm so happy. Every month on second Monday, we come together and we have between 30 minutes to 60 minutes a session, depending upon what topic we are talking about. And we take one topic and I talk usually as much as I can pass on the information, we do that. And I'm so glad that we have a global viewership. I don't know whether today we need to have a global viewership because I'm talking on MTP law, and obviously it is concerned only with India. So those who are from outside, stay tuned with us for the next year. You may not be with us this time. And I say you happy evening or happy morning, whichever area you are. Now, thank you, Corconnect group, the entire team who worked unanimously with me in getting this for last more than now, near 1 year. Namaste, Vanakkam, Sasriyakal, Namaskara, Chibai. Thank you, everyone, for being with me here. So today, actually my talk before was anemia with pregnancy, but we received several messages that why don't you take MTP Act and Law 2022? So we decided instead of tweaking on anemia, let's talk on MTP Act. Friends, about the MTP Act, some small story. Indian Penal Code in 1860. In India, anciently, abortion was regulated with section 312 to 316 of Indian Penal Code. And under section 312, it was stated that whoever voluntarily causes a woman with a child to miscarry will be punished with the imprisonment, fine, or both. Imagine, abortion was not allowed. This also includes if the woman does so intentionally. The only exception to this was in a good faith to save the woman's life, it was allowed. So friend, I cannot imagine what the life of a lady will be because in 1860, we all know the contraception was also not so strong. And that's where we had a grand multipara, PPH, and very high maternal mortality or septic abortions and deaths because of the septic abortion. Because legally it was not allowed, and lot of illegal abortions were used to happen. And that's why strong reasons make strong actions. These reasons of septic abortions to maternal mortality were the strong reason where India woke up and thought of doing something differently. Shantilal Shah committee set up to stem the high maternal morbidity and mortality associated with illegal abortions. Recommended a broadening and rationalization of laws related to abortion in 1966. And then MTP bill in Rajya Sabha in 1969 referred to Joint Selective Committee review and finally passed the MTP Act in 1971. The MTP Act 1971, it was an act to provide for the termination of certain pregnancies by registered medical practitioners and for matters connected therewith and incidental thereto. Legislated by the Parliament on August 10, 1971, the Act was enforced nationwide in 1972 April and adopted by Kashmir and Mizoram very late by 1980s. But of course, there were certain drawbacks, and that's where we have started working on. In the present time, when the developed most nation like USA is amending the abortion laws to make them stricter and prevent couples from using such measure, India is trying to come up with the amendment that would make it more accessible. So listen, who is giving empowerment to the woman? It is India. Lady has right to decide whether she wants this pregnancy or not. While in US, it is not possible. They are not allowed to terminate, which is absolutely horrifying. But that's why you all should feel proud to be Indian. The Medical Termination of Pregnancy Amendment Bill in 2021 is for expanding the access of women to safe and legal abortion services on therapeutic, eugenic, humanitarian, or social ground. So from 1971, we have in 50 years progressed very far, and many people in India, many gynecologists, I will say, I remember Dr. Nozar Shariar working on it, then Dr. Jaideep Tang working on it, Kuran Kurtakoti worked, and on legal side, Dr. Nikhil Datar, we all know how much he was working and asking the rights of the woman. So we need to be thankful to all these people who really work, where the substitution of certain subsections they asked for and insertion of a new clauses under some section. This is why it was very, very important. And they increased the gestation limit of termination of pregnancy under certain conditions and to strengthen the access to the comprehensive abortion care. Remember, from 20 weeks to 24 weeks, all these people, they worked very hard to convince the government that many congenital anomalies which are not viable, which are not good for the baby to carry on the life with, may not be diagnosed as early as 20 weeks. And that's why it should be extended. At the same time, after 24 weeks, there are many times we come to know that this pregnancy is not good, either for the health of a woman or for the baby. And we wanted special bench, not going in the court and all, but a special bench who can give a permission. And all these things got legalized. The act has not only affected the health of the mother and the child, instead, it has a significant impact on the status of a woman socially, politically, legally, as well as economically. I see many times the pregnant woman, they have got divorced during the process. They got separated during the process. And she don't want to carry the burden of pregnancy. So many things. The woman has become independent. Many a time, she may not have separated. She may be 7 weeks pregnant, but in her mind, she knows that her marriage is not stable. She don't want pregnancy at this situation. She has a right to approach. So all this has become very, very important. Now, MTP abandonment journey, if you see, 29 January 2020, Cabinet approved the amendment bill. 17th March 2020, they passed it in Rajya Sabha. These are very historical dates for all of us. 25th March 21, Honorable President's Asset and Amendment notified in Official Gazette. And then 24th September 2021, it act notified for the commencement. And 12th October 2021, rules of the MTP Amendment 2021 published in Official Gazette. Published by Nozer Sharia way back in 2002, Protective Umbrella. The MTP Act, if adhered to, faithfully offers complete protection to the medical practitioner. There are clauses under which we can do the abortion. And if we remain strictly adherent to it, we are here getting protection for ourselves. However, legal protection is only available conditioned to every requirement of the Act being fulfilled. Because it should be the registered medical practitioner where to do this abortion. All I'm going to cover in this. And if we follow in the legal framework, we are the safest. And I think this act or the bill or the law which has been passed is for the betterment of a gynecologist also. The MTP Act is an act of parliament providing an overview of safe abortion and delegating authority to central and state government. MTP rules are framed by the central government, but it must be ratified by each house of parliament. They are framed by the state government and relate to the issue involving opinion, reporting, maintaining secrecy. All this is very important, and state government has a power to overlook this. So it will be subdivided. How we do with the PCP entity is the same way. Now, what happened? Previous act, it was 20 weeks, only when immediately necessary to save the life of pregnant woman. Now it has enhanced to 24 weeks and further enhancement for the birth defects not compatible with the life. This is very important. Potential outcome: increase access for a vulnerable woman to safe and legal abortion services defined by the rule committee, includes violence victims, minor among the others, the rape victims. All these can be involved in it. Now, what are these social categories? These are the 7 categories. So when these 7 categories people come, you can do. I'm going to read that. The rape or the sexual assault, woman with pregnancy in humanitarian setting, disaster or emergency situation, change of a marital status during the ongoing pregnancies. Widow ho gayi. She don't want to continue her pregnancy. She feels it is a burden for her to carry her own. She is not financially independent, not to worry. Woman with the physical disabilities, mentally ill woman, including mental retardation, all the minors, but I'm going to talk about the minor later, and the fetal malformation, which are substantial risk of being incompatible with the life. Or if the child is born, it would suffer from such a physical or mental abnormalities to be seriously handicapped and it's not the worth living that life. These are called as a vulnerable woman and we can terminate. What about the unmarried girl? In the old act, unmarried woman could not cite failure of contraception as a reason for abortion. Remember this. But in the new amendment, MTP can be done in unmarried woman in order to prevent grave injury to the physical or mental health of a pregnant woman. Fine, unmarried girl hai. It may be a mental health getting affected and she can have a right to determine it. Gestational age for the fetal abnormalities, I have already told, 20 weeks previous act. Now, upper gestational limit does not apply in cases of pregnancies which have a substantial fetal abnormalities. So they can go to the medical board and then they will be. So who is the people in the medical board? The gynecologist, pediatrician, and the radiologist or the sonologist or the they will together come together and they can decide and they can take a decision even after 24 weeks. Some rapid fire questions. Live pregnancy, you need to report as a MTP. What about missed abortion? Am I supposed to report? No. So missed abortion, blighted ovum, incomplete abortion, intrauterine fetal demise, vesicular mole, ectopic pregnancy, complete abortion, and embryo reduction, they don't come into the MTP Act and you don't have to report. In embryo reduction, probably it was twins, you reduced to singleton, or it was triplet, quadruplet, you made it to twins. You allowed two pregnancy to grow ahead. So it doesn't come as an MTP and you don't need to report. Medical abortion upper limit. What is how long I can give legally the medical pills? Though the Act says 7 weeks, Drug Controller of India has given approval up to 9 weeks. Medical abortions are covered under MTP Act. Hence, all the rule and regulation has to be followed. This is very important. You cannot just prescribe the medicine. They have to fill up the form. You have to keep their name confidential. They have to be registered. And at the end of a month, you have to submit their data. Remember this, very important. Otherwise, you will be in trouble. Now, this is a very important. The MTP Act does not confer or recognize any right on any person to perform an abortion or termination of pregnancy. Even the pregnant woman cannot terminate the pregnancy except under the circumstances. She cannot abort because it's my will. This is not in the 5 criteria of indication of abortion on demand. It is not. Even during the first trimester, the woman cannot abort her on her will or a pleasure. There is no question on abortion on demand. Section 3 is only an enabling provision to say. Now, sometimes the ladies say, I don't want to write failure of contraception. I don't want to write it's a physical injury or mental health or whatever it is. I want to do it because I wish to do it. It is not allowed. Please, if they are not ready to sign, please don't do their abortion. Let them go wherever they want to go. So what are the requisites? 1, the registered center. It has to be by qualified doctor, in indicated patient. And most importantly is maintain record. If you understand all that, I'm going to talk each in little bit more detail. Now, what about registered center? Where pregnancy can be terminated under the Section Act, a hospital established or maintained by the government, or a place for the time being approved for this purpose by the government, or a district level committee constituted by the government with the CMO or DHO as the chairperson. The nursing homes where can be 5 rules. Government should be set. Now, nursing home can get the certificate. Barabar hai? All nursing homes, provided they got legal certificate from the government that it is a MTP, it is a recognized center to perform the MTP. And you need to have this certificate. So government should, how government will give you, when they come for an inspection after you fill up the form, they will come for inspection. They are very good. They come regularly and they should be satisfied with the safety and hygiene of your hospital or the clinic. The following facility should be provided for all the termination: resuscitation, sterilization equipment, drugs, and parenteral fluid. First trimester termination, gynecology or labor table, backup for treating shock, and facilities for transportation. While second trimester termination, you need to have a good OT table, instrument for abdominal and gynecological surgery, anesthetic equipment. So it should be well-equipped hospital. Where can be MTP done again? Further to this, medical method for termination not exceeding 7 weeks may be prescribed by the registered medical practitioner as prescribed under Section 2 and Rule 3, having access to a place. So suppose I'm doing consulting at my solo clinic. This is only the consulting room. Can I give a MTP? Yes, provided I have attachment to the hospital which is approved for a MTP for the termination. And that hospital should give me the letter that I'm attached, and whatever problem, if my patient faces after the medical line of termination, I give excessive bleeding, incomplete abortion, any emergency, then their hospital will be taking that patient. So I should have attachment to the recognized center, and that letter has to be with me. Then only I will be. Second important thing is, whatever I do medical termination in my OPD, I should be taking that data and should be sending to that hospital to put it into their monthly record. I think if you understand that, it is fine. To simplify what I do in my private practice, I don't have time for this. Any patient comes to me here, I call them in my OPD at Ruby Hall. And then in that OPD, then the paper, unka number, and everything goes automatically, smoothly. And I give the prescription there only from the hospital and do. So you can decide. If you don't have OPDs there, you have your friend nursing home, you can do that. Now, inspection by CMO. If he or she is satisfied that the termination of pregnancy can be carried out in safe and condition, they would recommend registration. The committee will give you registration in Form B. Certificate will be displayed in a conspicuous place in your clinic or the hospital. And procedure of approval should be complete in 4 months, 2 + 2 months. And they are also binded to give you this. Now, what about this? They come for a routine visits. They will check your registers, whether you are submitting the data and all. And anytime, if they are not happy, they can be terminating. Committee, after giving reasonable opportunity to the owner, if they are not satisfied, first day, they will not cancel you. But if repeatedly you are not maintaining your data, you are not submitting your data, you are not following the MTP law, they have a right to suspend or cancel your registration form. Now, what are the remedies if I get cancelled? Whatever their problem was, you solve those problems and you can reapply. And if reapplication, they will come for a review within 60 days by the government, these authorities, and they will. What are the penalties if you perform at a place not approved? So you will say, oh, my friend's nursing home, he is ready, I'm ready. But if that nursing home is not approved for the MTP, you may have 2 to 7 years imprisonment, of course. 2 to 7 years imprisonment for the owner or the administrative head of that hospital. So it's not only you, you are putting your friend also in trouble. And that is why, again, I'm saying, if you do the work in the legal framework, you are in the most safest hand yourself. So please follow the legal laws very. So who can do the qualified? Who are the qualified doctors? This is very important. Registered medical practitioner before commencement of Act was 3 years experience in OB/GYN. Now, today, RMP, in-state medical register, means medical practitioner who holds the postgraduate degree or diploma in OB/GYN. So any DGO, DNB, MD, fantastic. Medical practitioner who has experience of at least 1 year in the practice of OB/GYN. MBBS doctor doing a OB/GYN practice. Medical practitioner who has completed 6 months of house post in OB/GYN. He has done 6 months of house post. He left his further, but he has done 6 months. He still can do that. But this is only first trimester. Medical practitioner assisted in 25 cases of MTP, of which at least 5 done independently. They can also. Now, MTP after 12 weeks, the first 3 criteria they can do. The fourth one, that is 25 cases of MTP who perform, are not allowed to do second trimester abortion. So MTP from 20 weeks to 12 to 20 weeks, same as above, except 25 cases, as I told you, the last clause. Now, silent features. Previous Act, requirement of opinion of 1 up to 12 weeks and 2 for 12 to 20 weeks. Now, in new law, Requirement of opinion only 1 up to 20 weeks. And when it is 20 to 24 weeks, it is more than 1, that is 2 people. So if I draw the diagram, up to 20 weeks, 1 registered medical practitioner, 20 to 24 weeks, 2 registered medical practitioner, and beyond 24 weeks, it is the permission of a board with the 3 people, gynecologist, neonatologist, and the sonologist. What about the degree and diploma offered by the universities are not recognized by MCI? They are not allowed. RMP means Indian Medical Council Act 1956. A person obtaining qualification in any other system of medicine is not allowed to practice modern system of medicine in any form. This is very important. So anyone taking even the degree, they may be MD somewhere in Russia. They are not recognized in India to do MTP. They can do hysterectomy, they can do deliveries, but they cannot do MTP. They will be penalized by imprisonment. Indicated patient. What do you mean by indicated? These are the 5 grounds: risk to the mother, fetal anomalies, sexual assault, failure of contraception, and socioeconomic. So on demand doesn't come in this. Remember, friends, you will be in trouble. And now next, most important, whenever there is a law, you have to maintain the record, whether it is a MTP, whether it is PCPNDT, whether it is ART. So first is consent. Valid legal consent as per the section is mandatory. Termination of pregnancy in minors or mentally ill person only with the consent of guardian. And termination of pregnancy above 18 years with their valid consent is okay. Below 18, no. The guardians are must. Consent must be informed and recorded in Form C. An adult woman requires no other person's consent under law except her own. So you don't need a husband consent to do the termination. This is very important. And that's why I say woman empowerment. Now, this is very important, privacy and confidentiality. In previous act, the MTP mentioned that information should not be disclosed except under the authority. In new insertion, name and other particular of a woman whose pregnancy has been terminated shall not be revealed except to a person authorized by any law at the time being in force. So friends, you don't have to submit and you have to keep the name of them confidential. This is very important. Privileged communication. What is that? Regulation imposing the restriction on disclosure of information contained in an admission register to any person except Chief Secretary to the government in case of a departmental inquiry, or to a magistrate of a first class within the local limits of whose jurisdiction the approved place is situated in, or to the district judge within the local limits of whose jurisdiction the approved place is situated in case of a suit or other action of damage. Only then you play in the court, you can disclose the name. Associated authority shall ensure that there is no violation of MTP Act and rule while implementing PCPNDT rules and Act. Now, impact of the Act on Indian women. This has become very good. Rape, victim, it may be a violence. The MTP Act has given women sufficient period of 24 weeks of gestation to abort the pregnancy. Unfortunate girl of rape, she may not even bother to think. She may be psychologically disturbed to notice. Anxiety, stress may give her amenorrhea. She may not even bother. She may be a PCOS with the irregular menses. She diagnosed the pregnancy first time when there is a baby movement inside. She has the right to come and meet. Ensure privacy. The Act has aimed to ensure the right to privacy for the woman who wants to go through an abortion. Progressive. The MTP Act allows unmarried women to medically terminate pregnancy while also protecting the reproductive rights of the woman. Anomalies, if they are there, of course, she don't have to carry anomalies. If a patient with the history of alleged rape comes for an MTP, should we mention rape? It is your duty as a citizen to inform. Now, what happens? The lady may not want to disclose it to police or anyone that she had been raped, and she comes to you for MTP. You need to inform this to the police. Very important. I do understand will have a sympathy for the lady, but at the same time, if it is a rape, you need to inform. It is your duty, even as a citizen, to inform the authorities, police or magistrate, about any cognizable offense that you know, punishable under otherwise. Without permission, if you terminate the pregnancy, it might amount to destroying the evidence. The same lady can go to the police later and turn the case on you. So please, not to be emotional, inform this to the police. Now about documentation. What are the various documentation? ABC, Form 1, 2, 3. What are they? Form A means application for any nursing home or a clinic who wants to apply. Form B is the government who is giving you certificate of approval. And Form C is the consent form which you take from the patient at the time of MTP. Form 1 is form of certifying opinion from RMP. I'm going to show you. Then is the envelope. You have to put that in an envelope and seal it. Form 2, because you need to be secretive. Form 2, monthly statement of the cases which you send. And Form 3 is your register. Again, it should be logged. So, OPD case sheet, managing name with the patient versus kept as a part of a clinic record. Proof of identity, age, not mandatory. If minor, this is totally different. POCSO Act sometimes can come if the patient comes to it. Proof of a marriage is otherwise not required for above 18. Consent in Form C, to be kept sealed in any envelope for 5 years. Only the woman's consent if she is more than 18 years, and guardian's consent if for the minor you are doing the abortion. So this is the MTP consent form, Form C. You should be keeping this. Now, this is a Form 1. This is how we send the number to the government and we maintain the register. According to the MTP regulation, centers are required to maintain admission registered in the prescribed format 3 and preserve for 5 years, all the register. This is a secret document to be kept in a safe custody. C form, Form 1 and Form 2, and MTP report to be submitted in Form 2 and Proforma 2 must also be maintained. Additional attention for a legal. See, this is all very important, and try to understand and go online and see what are these various forms. MTP amendment, concept of regulation, rigorous imprisonment for a term not less than 2 years, but which may extend to 7 years, termination by a person not an RMP, termination in place other than identified in Section 4, owner of a place which is not approved. All this has to be seen. MTP registration, that is MTP admission registration, register, that is Form 3. All patients undergoing MTP to be entered, fresh serial number to be the commencement of each calendar year. Serial number 1, 2, 3, 4, 5, this is how you should keep. This register is a secret document. It must be maintained for a period of 5 years. Register not open to inspection and except under authority of law, and only serial numbers to be written in all case sheets. So in a case sheets, you can't, so the patient's name, instead of a name, the number comes. The serial number should be put up. MTP admission, register, and medical abortion. Even medical abortions has to be entered. I have already emphasized medical abortions carried out from clinic should send their record to the approved places. I have already told you this. For medical abortion, consent has to be taken in the C form, statutory consent. MTP without consent, 10 years rigorous imprisonment, friends. Please, it is safe to do MTP, but strictly in accordance with the Act. Write the indication to as in order to prevent grave injury to the physical or mental health. So this is how you have to write indication, whatever was that. So when abortion is considered safe, by appropriate method, by trained method, it's safe. So you have done by appropriate method and by trend RMP registered. Less safe, only one criteria made. Appropriate method, but not by trend person. Not allowed. Unsafe, when both are not. Appropriate method, neither your registered center you have done, nor by the trend person. It is unsafe. No woman is required to build the world by destroying herself. She has the right to decide what she wants. And that's very important sentence, friend. Friend, I know this is an academic session, but this is my Foxy presidential election. They are just 3 weeks away on 1st August. I humbly request all of you to bless me. Thank you so much for your patient hearing. Thank you.
Thank you so much, ma'am. It was great.
If anyone has problem, any issues, we have 2-3 people from Foxy. One is medical legal person, Dr. Manish Machwe. They can contact. We have Richa Sharma, who is a chairperson for MTP committee. They can contact. Any problem, they can always contact to Foxy President, Secretary General. They all are there to help them. Thank you.
Thank you so much, ma'am. It was great learning. It was great hearing from you. We have successfully completed today's series. And as per the series, as per the tradition continues, it will be soon imprinted in the flyer with all the later series which have been done. Thank you so much for your kind words and for such a long last knowledge. Thank you so much. And this is Piyush signing out.
Thank you, Piyush, and thank you, Team Corona. Thank you. Bye, dear all.
Thank you so much, ma'am. Good